Good
Yes,
afternoon,
Sujata.
everyone. Good afternoon, everyone, once again, and thank you all for joining on time. The purpose of the workshop is to provide some education regarding how to recognize misinformation online on COVID, working through several examples relevant to COVID that have been in the media over the past 18, 20 months. And we've got Dr. Milind Girish here today to give more in-depth of information on COVID. Before I hand it over to Dr. Milind, I would like to firstly, we have muted everyone, but just in case you're not muted, please could you be able to mute yourself? You can choose your camera on or off. This event is being recorded. And so if you would prefer not to be recorded, then you should turn your camera off now. And there is live streaming on TMR's YouTube channel now, which is going on live. So we will share the link later with you, and you can share it with someone, or you can view it to get more information or listen to it again. To ask questions, tap the chat option along the bottom of the Zoom panel. I may not be watching closely because I may be busy talking or listening. So we will come back to any questions raised at an appropriate time during the event. We have got a Q&A session later after a short introduction by Dr. Milind. If at any time your connection drops, don't panic. You can re-access using the original Zoom link that we have given you. Alternatively, you can use the password and meeting ID that we have shared in the chat box earlier. If you haven't, then Sangeeta will be able to put it on the chat box. The event, again, as I said, is being organized by the Mentoring TMR, a charity based in Wales, United Kingdom. And I'm Sujata, founder and director of the Mentoring charity. The mentoring supports individuals through mentoring and guiding people of all ages and backgrounds. And if you've got anyone who'd like to be mentored, you can refer them to us. Our charitable objectives are to promote social inclusion for people who are socially excluded through a variety of means leading to disadvantage, in particular through ethnic and cultural background, poverty, geographic isolation, and health issues. At TMR, over the 20 months, we have worked to support the people suffering from the economic and social impact of the pandemic, helping vulnerable people through mentoring and engaging them with a range of activities to cope was and is our first priority at the moment. To know more about the Mentoring TMR, please visit www.mentoring.org.uk, or you can tweet us on @thementoring. I think the details are on the chat here. As I mentioned before, the purpose of the workshop is to provide more education regarding how to recognize misinformation online, working through several examples relevant to COVID that have been in the media over the last year. I'm sure all of you got confused and you didn't know what to do, you didn't know who to ask. So we have here Dr. Milind Girish. Milind Girish is a recently qualified doctor, currently working in London. Milind is also part of the advisory group of the Mentoring, our charity. We are proud to have you, Dr. Milind. Over to you now.
Thank you very much, Sujata. I'll just share my PowerPoint. Give me a second. Can everyone see my screen? Is my screen up? I assume it is. I'll just carry on. Okay, fine. So good afternoon, everyone. As Sujata said, my name is Milind Girish. I'm a recently qualified doctor, currently working in London. The purpose of today's session, as mentioned, it's to arm you with a toolkit that you can use when approaching information online, particularly in vetting how reliable is what you're reading online. The best way to learn is to always apply what you're taught. So after outlining what to look for, we'll be using several real-life examples in social media and news, specifically revolving around COVID. So we can see here, this is the outline for the talk today. It will be about 30 to 40 minutes, and then we'll discuss some questions afterwards. The questions will probably mostly be answered regarding misinformation. If you have other questions, we're hoping to make this into a series. We can, sort of look into the questions and then come back with answers in future sessions if necessary, but we'll get to that towards about 3:40, 3:45. So to start with, what we've got here is a broad checklist published by the US Surgeon General. Now, this will be very relevant as we go through the talk, and so I'd like to highlight that I'm going to include myself, all of my sources of where I've got information within the PowerPoint, and I'm happy to share the PowerPoint afterwards. We can send it out by email as per request, and all the links for the articles and the research will be within the PowerPoint itself. Now, let's see what we can take away from this outline right here. And I've summarized it into 3 main points. When you're looking at an article online, ask yourself, where else can you find this information? Is it repeated by a credible source? Or is this the only place that you're seeing this information and you can't quite see anyone else saying the same thing online? Number 2, who wrote this article? Is it a credible source? Double check, does this person exist? If they've said, oh, Dr. So-and-so said this talk, it's very easy in the UK, for example, there's something called a GMC register. You can just type in a doctor's name and see if they even exist. It's very easy to do that. And sometimes doctors have their own profiles and you can see if they're sort of agreeing with this sort of thing and saying this online. So who wrote it? Do they exist? And are they saying what the article is saying that they are? Number 3, does the article include any sources for what they're saying? Are they making claims, but then giving you no sources to say, here's the evidence for what we're saying? And again, we'll go into each of these as we move on. We've got 3 broad examples here first. I know it's an infographic. It's actually from the same document that the US Surgeon General published. I believe these are based on real life examples, but for now, just for this slide, we're just looking at concepts for now on how information can be manipulated. We'll delve into some definite real life examples from the next slide. You can see over here, example A, we've got quite a dramatic looking graph where there's a big decline over time. And what the article is saying is there's a decline in flu vaccine uptake in university students over 3 months. But when we look at this graph closely, we can see that it's actually really, really zoomed in and the graph doesn't start from 0. They've zoomed into a tiny part of this graph and to make it look more dramatic. If we actually looked at what the graph would look like if it was from 0 up to 50,000, the graph might look something like this, a lot less dramatic. And so while not necessarily a lie, this is information that's been manipulated to look more dramatic to fit with what they're saying. The second example is a social media post that I believe I've seen actually. It was about a year ago on Facebook. And what it was is, and it was on news articles as well, actually. And the news articles are saying, they're in uproar because we're in the middle of lockdown and they have a photo of people partying with no masks on. And the article is saying, this is ridiculous. We're in lockdown and people are partying. No one's wearing masks. No one's social distancing. And this was on news articles around a year ago. But it turns out that this photo is from 5 years ago, before the pandemic ever existed. And so people never checked where this photo was taken, where this photo is from, but they just posted it onto news articles and people got worried. People were saying, oh, no one's following rules. But the photo wasn't what they were saying it was. So it's important to ask yourself, if there's a photo that they're showing, is this really what it is that they're saying? And then thirdly, quickly, sometimes websites can look professional, but then you shouldn't necessarily believe everything they say simply because a website looks professional. And now the last example that I'll go into before we jump into the sources that I have. A while ago, I couldn't re-find this article. So again, we'll just keep it at a concept. I noticed a post on a social media platform called Reddit where someone was complaining about this. And now if we read this sentence says, vaccines are 90% effective at preventing hospitalization. And what this person was really upset about was they believed that what this meant was that if 100 people had the vaccine, they thought that this meant that immediately 10 people would be hospitalized. And the trouble is that I'm not making fun of them here. Sometimes it's really difficult to understand what figures mean. And it's easy to jump to conclusions or not quite interpret what the meaning is behind what you're told. And so if you can't double check what you're reading with another health professional, another doctor, It's easy to make mistakes like that. Just to clarify, I'll just so when there's no confusion, I'll explain what this actually means. When we say that vaccines are 90% effective at preventing hospitalization, looking at the figures, I believe that the Pfizer study actually showed it was 93 to 95%. What that means is that if 2,000 vaccinated people are around, you might expect one of them to be hospitalized because of COVID. And out of 2,000 unvaccinated people, you might expect 20 to be hospitalized because of COVID. And that's where the 93 to 95% comes in, because going from 20 to 1, that is a 95% decrease in hospitalization. So it's not that people are getting vaccines and immediately 10% are hospitalized. The actual reality is that if we vaccinate everyone, we'll have 95% less hospitalizations. I hope that makes sense. And now we'll jump into some real life examples. So this was a tweet from the famous rapper, Nicki Minaj, in September, just a few months ago. And she has over 20 million followers on Twitter. So a lot of people will have been seeing this. And what she said is that her cousin in Trinidad doesn't want to get the vaccine because the cousin's friend got it and became infertile, and the cousin's friend's testicles became swollen, and then his wedding was called off. It was a nightmare. And then she said that make sure you're comfortable with your decision and that you're not bullied. And on the final point of what she's saying, I completely agree. You should be comfortable with your decisions. It's your health. Make sure you speak to doctors about what you're doing. It's your body. But there's some problems with this article, this tweet, shall I say. Let's go into that. Firstly, before the entire COVID pandemic, people still became unwell, and people still had swollen testicles, or orchitis it's called. And some people had issues with fertility, and some of these people are young. Now, the thing is that now, Trinidad, about 45% of people are vaccinated. And I got that figure from this website that has a lot of data on COVID per country. That's almost half the population. It's like finding someone in Trinidad and you flip a coin and they might just be vaccinated if it falls on heads. Now, because a lot of people are really worried about everything that they've heard about vaccine side effects, when a case of swollen testicles pops up, they might assume immediately that it's because of the vaccine, because we're all so on edge. We've heard, vaccine causes this side effect and that side effect. And it seems that's what Nicki Minaj and her cousin has assumed here. But how do we know that that case of swollen testicles wouldn't have happened even without the pandemic being around, without a vaccine, without COVID? The answer is that from that one story or an anecdote, it's impossible. We can't know. And we all love anecdotes. We all love these stories because they're so emotive. We hear our friend talk about their experience. We hear someone else talk about someone they know. And immediately that rings within us. And we listen because it's so emotive. But the trouble is, there's three main things I'm going to bring up about anecdotes that cause a bit of a problem. Firstly, we don't know how much of an individually shared story is true. I'm not saying that Nicki Minaj is lying. What I'm saying is that when we read this, we have no way of proving that this is true. Nicki Minaj may have had the best intentions, but it's almost like Chinese whispers at this point. Someone has told their friend, who is her cousin has told her, and now she's telling us. Who knows what's been lost in translation at this point? Not necessarily translation, but along the story of telling the story between people. And then that brings us to context, because we know very little context to this story. If this story is true, perhaps this cousin's friend did get orchitis, there could be a lot more to it that we don't know. There are actually various other causes of swollen testicles, and the most common cause is actually sexually transmitted infections. We don't have any of that information here. No one's saying, does this cousin's friend, has he had a sexually transmitted infection recently? That's entirely possible. We don't have any of that information. And then thirdly, when it comes to anecdotes, the only way we can really show would this case of swollen testicle happen before the pandemic? Is it relevant to vaccines? We need to compare it to research. That's the best way of finding out. And so what I've done here is I've included two links to research. Feel free to look into it in the future, relevant to fertility and COVID and vaccines. The first one, what it shows, is that there was no effect of vaccination on men's sperm counts. So saying that there's no effect on fertility if you get vaccinated. And then the second article shows actually that COVID itself, a COVID infection, does decrease men's sperm counts. So the research shows that COVID infection might have effects on fertility, but there's no research suggesting that vaccines have any effects on fertility. So in summary, overall, what are we saying? Are we saying that Nicki Minaj is a liar? Not necessarily. I'm just saying, one, we don't have a verifiable source on what she said. Two, we don't know any context of this case. We don't know all the details about this person. And three, the research actually doesn't support what she's saying. And all in all, this is an example of why we shouldn't be using anecdotes to make decisions about our health. Moving on to the next example. This is a social media post that did the rounds earlier this April on Facebook, actually. And what it shows is 2 CT scans. And apparently the left one is of someone who's vaccinated, and the one on the right is the one of someone who's not vaccinated. And clearly it's saying, get vaccinated. If you don't get vaccinated, your lungs will look very, very bad, as what's shown here. The trouble is, this post is actually misinformation, and it's information that's been manipulated. And I've included this to show you that misinformation is not just on one side of the argument. Even media encouraging COVID vaccination can be subject to the same flaws as everything else that we've been looking at. What I'm encouraging for you is to think critically and ask the right questions. The first issue here is they've mentioned Dr. Sumit K. Dubey here. Firstly, does this doctor exist? Did he really share this? Looking at this doctor's Twitter post, he does exist, but I couldn't find any mention of any of this on his Twitter, so perhaps they've just named a random doctor to give themselves more credibility. And then the second big issue with this post is that these photos are misrepresented. The photos are actually from a different study a year and a half ago when we didn't even have vaccines, and the study is about something completely different. It's about diagnosing COVID. And so what's happened here is they've taken a photo of something else, presented it to match what they're saying, to push what the viewpoint is. Now, if we actually look at lungs of vaccinated patients versus unvaccinated patients who got COVID, would we see a difference? Probably would, but that's not what we're talking about here. And this photo is not that evidence. So again, approach it with the same critical mindset and ask the same questions. Moving on to the next point. Finally, we get to a good example of information online. As always, I've included the link for anyone to read in the future. It's just at the bottom right there. And it's a short article looking into the research around 3 claims about vaccination affecting fertility. I've just pasted bits here from 2 of these claims. And it's a bit of a fact check article looking into what's the research around these claims and theories. And we can see that the authors are clearly labeled here, not only the author of the original article, but the doctors involved in the research that's discussed. And secondly, we can see the context of the studies. It's explained very well, and clearly the sources are included. That's really important. You can click on these links here in the actual article and here, and it'll take you straight to the research that they're talking about. There's no hidden agendas. There's no hidden, here's the point that we're making, but there's nothing to back it up. It's all there. They explore the studies, and I think it's quite a good article, and it's quite short, actually. It's like less than a page long, so very easy to read. Now, moving on to the next point. Unfortunately, we're back with the BBC here again to show the opposite of the last slide, a BBC article that actually has quite a few problems with it. And this is to show you that just because a given platform such as the BBC can put out fantastic informative articles, it doesn't mean they get it perfectly right every time. Again, it's all about maintaining a critical mindset and asking the right questions no matter what you're reading or what you're watching. They make claims like this. This is directly from the article. They talk about this specific drug that's used in the treatment of COVID. And they say in this article that of the 26 major trials, more than a third have serious errors, and that none of the rest show convincing evidence of the effectiveness of this drug. Except they don't cite anything. They don't cite the 26 trials, and they don't cite what looks like an analysis into these 26 trials. And that's quite a red flag. Articles should not be making claims like this without citing what they're talking about. In research, you absolutely have to cite every single point that you make. If you make big claims like this, you have to show where you got your information from and how you made your reasoning. So for the BBC to be putting out articles like this with no sources, it's quite worrying, actually, specifically for this article. Now, I tried myself to find what I think is an article analyzing 26 major trials that they're talking about. And I searched some of the literature, and I kind of struggled to find what they were talking about. What I think they might be referring to is possibly this article here. But actually, this article isn't even original research. It's what's called a correspondence article, which is more or less a discussion about other papers. But the 26 papers the BBC mentioned are not critiqued or cited in this article. They just discuss some of the things the BBC mentioned as well. And on a separate point, I actually disagree quite a bit with some of the things that this article said too, but we won't go too far into that today. Now, again, some of the critique of the BBC went further into some of these specific studies, talking about apparently a study in Lebanon that copied and pasted blocks of details. If true, that's really bad. Apparently, this paper has been retracted, but I looked online and I couldn't find this study either. So does the study exist? Did it have problems? I can't tell you because I can't find the study. BBC didn't link it. I struggled to find it. We can't verify what's being said here. Now, following our checklist, where we mentioned at the beginning about source. Clearly, we've just mentioned that there's no sources to what the BBC is saying here. We can move on to authors. Now, in terms of authors of this article, we can see two here. It's really interesting that Rachel Schreier is actually the author of the previous article that I said was really good. And that article did really well with referencing all the sources. So I'm really not sure why that didn't happen here. It seems very strange that it was such a good job on the previous one, but then there's no sources here. And again, it's just about approaching with the mindset and asking the same questions to be able to pick those differences out. Now, the thing is, both of these authors are actually, as far as I can tell, they're not medical professionals. They're both journalists. So looking at these claims of serious errors and unconvincing evidence, if they're not medical professionals, they should be really citing who has analyzed these trials, who has looked into this data, and who is claiming that they're not effective and have serious errors. And in the absence of any sources where we can see which doctors and which research scientists are actually saying this and how they've come to those conclusions, this article is asking us to entirely trust the interpretation of medical research by people who aren't research scientists or doctors. Now, moving on to our final example. Here is another good example of information that ticks our checklist boxes. The author is clear. It's a YouTube channel, actually, and it's specifically a video looking into blood clots and vaccines. And there's been a lot of talk about this, where people have been getting blood clots after vaccinations, and we'll talk a bit more about that now. Now, the author, the YouTube channel is of Dr. Omar Danoon. Sorry, it's a bit small there, but we can verify. You can look online and see that Dr. Omar Danoon is a doctor in America from Detroit. And he's got quite a few videos discussing these sort of things. And fantastically, his sources are all clearly highlighted and included in the video description. Now, I've got a little figure here. And what's this talking about? Well, CVT is cerebral venous thrombosis. And what that is, to put it simply, it's a clot in the veins around the brain. And that's one of the things that was noticed in some people who had the vaccination. In the time after they had the vaccination, they developed this CVT or a clot, okay? And the study that I got this from, it's right here again, and it's what Dr. Omar Danoon talks about. The incidence of the CVT seems to be 6.8 per million people based on this study in the 2 weeks after the vaccine was given. Now, is that high? Is that low? It's impossible to know unless you have something to compare it to. And that's really, really important to think about, because news articles will often give you a figure and they'll give you nothing to compare it to. And it's easy to say, oh, look how worrying this is. 7 people, we're giving millions of vaccines. How many people are getting these clots? But what are we comparing it to? Well, take a look at this. Patients who get COVID infections, the figure is 43. So almost 6-7 times higher. So if you had the choice between getting COVID or a COVID vaccine, just looking at clots alone, and of course there are far other, a whole host of other side effects to actually getting a COVID infection, but looking just at clots, if you get COVID, you're far more likely to get this clot than you are if you were vaccinated. And even something like the flu, which the paper also includes figures on, if you get the flu alone, and we all know about the flu, a lot of us have had it over the last few years, several years, The chance of getting CVT is 16 per million people. It's even higher. So again, the takeaway here is if you're given a source for figures, you might be given the source where it came from, and that's fine, but you need context to understand where that fits in. And is it worrying? What are we comparing it to? That's the key takeaway point here. I hope that was really useful. Before we summarize, I've included several channels here. I've already talked about Dr. Omar Tanoon. Dr. Mike is also quite good on YouTube, talking a lot about COVID misinformation. Dr. John Campbell is also quite good. He looks a lot into the figures as they're developing. He puts out regular videos and sort of analyzes articles that are misinforming you sometimes, and how the pandemic is developing. This here is where I got the original toolkit on the very first slide. And this final point here is a website for the WHO where they go into a lot of information about vaccines. Overall, we can summarize everything that we've discussed into these 5 points. Firstly, where else can you find this information that you're reading? Is it repeated by a credible source, or is the only place that you found this what you're looking at right now? Secondly, who wrote this information? Was it a doctor? Was it a healthcare professional? Can you verify that that person sort of talked about this? Do they even exist? And thirdly, have they included all their sources? And if you click on the sources, if you just skip to the conclusion, often that's the best place to look if you're just looking into research papers, because sometimes it can be quite overwhelming. Just look at the conclusion, look for a line. Are they saying the same thing that the article is saying? Because sometimes the article can twist things as well. If there's any media like photos in the article, could this photo have been faked or manipulated or be of something else? And if you're given any figures or graphs, have they sort of manipulated those, or do you have something to compare those figures to get context on the situation? And of course, be careful of anecdotes, as we discussed earlier with the Nicki Minaj example. With how much information out there, it's genuinely really, really difficult to know what's true and false. And sometimes it's genuinely just really unclear. Sometimes there is no right answer. What's really important is to update your views as you get more information and to not hold steadfastly in the face of evidence to the contrary. Just be willing to change your mind and look for good sources of information, think critically about them, and be willing to accept change. And that's really how we're best able to tackle misinformation. I hope those examples were useful. Again, feel free to just ask for this PowerPoint afterwards, and we'll be happy to send it out. If you have 20 seconds, we'd really appreciate just scanning this barcode and giving us some feedback. You just use your phone to do that. And I'm happy to answer any questions perhaps about misinformation as and when now.
Thank you very much, Milind. That was very, very informative. Just to recap, this year, February 2021, we had our first event on COVID infodemic. That was basically on people did not know what COVID was and how we could stop, so vaccination, importance of vaccination. So we brought in a virologist from USA, and he gave a complete, analysis of what is pandemic and how it was, last pandemic, how it was recovered. And it was a very good presentation. So we have given the link here, YouTube link. It's still live on our channel. Those who would like to watch, you can watch. But now we have come to a second stage where people still do not know, wherein Milind has come here to give us more information of what you should rely on, how you could cope with the misinformation. So thank you very much, Milind. Anybody has got any questions, you can ask, but I have got one question. I'm not sure whether you'll be able to answer. This is somebody anonymous, like if a person suffered severe headaches, heart pumping, heartburn, extra with the first jab of AstraZeneca, is it safe to be injected with a different vaccination? The third one, example, Pfizer. The patient has underlying health condition. So would you be able to answer this, or do you want to pass it on to the next session? It's up to you, Milind. Over to you there.
At the moment, and then there's one thing that I could look into for the future one. So firstly, it's impossible for me to give individual health advice without discussing with that individual. So I highly recommend that that individual discusses this with their GP, because of course, to keep it anonymous, we don't want to be discussing their personal, like what health conditions they have. And that could really like have an effect on the advice that's given. So definitely something to discuss with the GP, because it also depends on exact nature of like what the side effects were on the initial jab. So that's my number one advice: go to the GP and discuss it. My impression is that it would probably be fine to have the third jab, but again, please discuss this with your GP and don't take that as advice specifically. But the question I can see within that question is if you have sort of effects and reactions to one type of vaccine, can you switch vaccine types? And then do you have similar reactions to that? And I don't actually know the answer to that. And it's really important to accept that you don't know the answer all the time, because there's so many questions you can ask about COVID. You can ask about a whole plethora of side effects. You can ask so many niche different questions, and not everyone has the answers to this. I think that's quite an interesting question, actually. And I'm happy to actually look into whether there's been any research into, the cross-reactivity of different vaccine brands. That's something we could definitely sort of bring up in the next talk as well. But to summarize, for that individual's advice, please discuss that with your GP. But in terms of, is there cross-reactivity between vaccine brands? I don't know, but I'm happy to look into it.
Thank you, Milind. Do you want to stop sharing so people can, sharing the screen so people can see you? Yeah, thank you. I've got lovely chat here. Can you see here a chat? Somebody said, Zar said, oh, 1 second, I can't go there. Oh, yeah. Sometimes we can't check the information because media removes them. Example, there's not really freedom of speech with Facebook. They automatically remove any posts which are negative towards the vaccine. So is there anything that you would like to ask, Zar?
So firstly, I think you'll note that one of my slides, it was about misinformation the other way. So I'm not like, it's very important to recognize that just because something's pro-vaccine, something's pro get vaccinated, doesn't necessarily mean it's automatically true. People manipulate information on both sides. And again, we're just encouraging the mindset to find that information yourself and look into where are their sources. I'm aware about this Facebook freedom of speech issue as well. And I think it's really interesting. What I've noted recently, there's actually some articles I was looking into. I don't have them off the top of my head, but who fact checks the fact checkers? I think it's a very interesting question. Facebook has these fact checkers going around, and they take down articles, sometimes on both sides, sometimes I think predominantly with the anti-vaccination posts. Even if it says a hint of anti-vaccination sort of like agenda, they're taken down. But who fact checks the people who are fact checking these things? And sometimes I've noted that they list the fact checkers for certain articles. They'll flag something up being like, this has been fact checked and maybe misleading. And then you look at the author of who did the fact checking, and they have no scientific background. They're like a journalist. They're not a medical professional. They're not a doctor. They're not in research as well. So there is a worrying question there about freedom of speech. And who is taking down these posts. On the other hand, I think Facebook, you've got to be quite careful, because a lot of what's on Facebook is anecdotal. People are talking about their own experiences or experiences that other people have heard. And as you mentioned, there can be some issues with anecdotes, very difficult to verify. You don't have context. Sometimes people leave information out. There's a lot of things to do with that. But whenever you find information, I encourage you just to approach it with the mindset that we discussed, and hopefully you can sort of develop your view based on that.
This is exactly where we come from, the mentoring. People come to us and ask us questions, so we allocate a mentor to talk to them on a confidential manner, and then we refer them to GPs or anything. So thank you. Any more questions?
Can I ask something?
Yeah.
Recently, I seen a program. It was kind of from a doctor talking about vaccinations and the heart. Does it affect the heart? Recently, 2 days ago, I think I saw it. And they were saying there is a relation, something like that, more heart attacks or more heart problems. I'm not sure. It's just as, on the television. So it's from the, trusted sources. If anybody can, answer that.
So to stick to what I've been sort of talking about, if I were to answer that properly, I'd need to give sources and all of that. And again, I don't have that off the top of my head, but I have also heard similar things. I think there's a lot of research going in currently about whether there's a link. It's not heart attack specifically. It's something called myocarditis, where like there's some inflammation around the heart. There have been some cases, again, just like we discussed, where there have been some cases of clots after a vaccine, but you can't stop the story there. You need to ask yourself, what's the context of these numbers? Is there, is it increased compared to the normal? How is it compared to COVID? If we're trying to avoid COVID and COVID causes myocarditis, are we getting a lot less myocarditis because of the vaccine, but simply because we're giving so many vaccines, we're still getting cases? I'd need to look into that as well to give you a full answer.
Thank you. Thank you very much.
I just wanted to say that as we haven't got the answers, with vaccines, it takes, you have to work a lot on creating a vaccine and have work done on a lot of people before we can come to saying that this vaccine is good or not. And we are still just wondering if it's going to cause myocarditis or any other health condition. Surely, do you think this vaccine should really be? Is it really useful? Is it should it be given?
I think that's a good question, because it's sort of a balance, right? And the trouble is, when we were deciding whether to go forward with the vaccines, you're in a very tough position. You can either, because in that situation, inactivity isn't acceptable. If every day that you delay, hundreds, thousands of people are getting COVID. So there's an argument which says the longer that you delay when you have a vaccine program, one argument is that you're causing lives by delaying. And of course, the other argument, which is also very fair, is that we really, really want to be sure that these vaccines are safe and that we're not causing harm by giving them. And so there's a balance there. And again, I don't know if there is a right answer. If the right answer was we started immediately when we started. But I think from the evidence that we have, one thing that we know is that the vaccines reduce hospitalization due to COVID. And from what we're seeing so far from the clots paper that I showed you, is that even though there is a very, very small risk of the clots, like I mentioned, when you compare it and have the full context, COVID, it's significantly reduced compared to COVID. So I think that we have enough evidence to show that vaccinations are necessary at the moment. But again, it's about being open and if there is information coming out about myocarditis, to look into that further and do more research into it. I hope that answers your question.
Yes, but like looking at people having clots. If a patient, if a person hasn't been diagnosed with, for example, DVT, and gets this vaccination, he or she might develop the clot. But so with these people that we're vaccinating, it really, are we really doing it with open eyes? Because, for example, myself, I've got DVT, and this was I developed it about 2 years ago, and I'm on anticoagulants. But so that's why I thought, okay, I'm safe enough regarding this. But if I didn't know about it, like I didn't know that it just developed, and if I was in the process of it, then surely I would have died. I would have could have had a heart attack, could have gone to my brain, whatever. Just coming to the side effects of the vaccine. So surely, are we? Do you think we are doing the right thing? I know, I know. It's better the less. It's the less of the two evils. I mean, it's better to have the vaccine than not to have the vaccine, because it's not causing those many damages, but still, important conditions like thrombosis. I mean, we'd have to be really, really, really careful, wouldn't we?
Absolutely. And I think that's one of the really important things, is that as research comes out about this and as everyone's more aware, doctors as well in the healthcare setting can keep an eye out for this and know that it's something to look out for. We can inform patients, if your calf is suddenly red and swollen, immediately go to A&E, because that's something to look out for. We can educate people more as well. So that's, it's difficult though, because it is a balance, and lesser of two evils, as you said.
Yeah, but and also, we've got a new variant now, just recently, and now surely, I mean, these variants are going to, we're going to have lots of variants, because we're giving the vaccine, maybe stopping that particular virus, but then it's going to mutate and become another one and another one, another one. So is it going to sort of go on and on and on? I mean, I know it's all medical, and it's all experiment. We're trying to find out the right thing, for the to cure, to help patients, to help people. But still, by controlling this particular virus, we are giving them space to create another mutant. So there's a mutation. Just yesterday or the day before, they've got another one. So what's happening with that? So will we be able to go to Pakistan, India, or wherever? You know what I mean?
I am aware of this new variant, but I don't know too much about it. And I think there's actually a whole research field that I don't know a lot about, but I'm aware that it exists in terms of the virus mutations and development. And you can sort of like track the sort of mutations that the viruses are doing. And that's actually how we have different flu vaccines every year, because they have organizations that track these sort of mutations, and they sort of choose which mutations are the variant that's going to be causing problems in the flu, and that's the flu jab that they give. So I don't know too much about that. But I think we're still early in the case of, we're still giving, we're now at the first point of boosters, and we're sort of looking into boosters as like a regular thing. Who knows how that will affect the development of the new variant. I'm not sure if I have the answer to that, but hopefully we can be positive.
We have to work a lot on this, don't we? It's, I don't know. I think, since you're into it and you're a young budding doctor, I think you ought to really take this up and find, go into it in detail and find out the ifs and buts and the positives and negatives. And it'll be very good for you, Milind.
Thank you, Yasmiji. Yeah, that's what Milind is doing. This is the first of Milind's series. He's going to come back next month with another set of questions. One more question, Milind. I just wanted to ask you, how resilient are these vaccination for new variants?
I think there's data on that. And I don't know, clearly this new variant that came up a few days ago, we don't really have any data on that. But I remember seeing, and again, it's difficult for me to say this without giving you sources, so we can come back to this in a future talk. But I remember reading that the booster doses are quite effective at stopping the Delta variant, which was the last variant that we were all worried about. So I assume that's the next big question is, are the vaccines that we currently have, do they need to be tweaked a little bit for this new variant, or are we okay with giving boosters? That's a very good question to ask.
Thank you.
I think there's I've just put a link on the chat. As I mentioned, I haven't read it yet, and I don't know how trustworthy it is. It appears to be from the British government, and they've mentioned something about the variants. Apparently, if you've had COVID and had 2 vaccinations after, it can make you more I don't know the word. Hold on. It can make you more less likely you'll be able to fight other new variants that come along.
Okay.
That's what I haven't read it,
Sure. So that's an interesting question. It's not something that I've heard before. I'm very keen to read this document, and perhaps we can start with this document in the next session. Yeah.
If it's true.
Yeah, of course. Yeah, because again, we're at this point now where you brought something up that's really interesting, but we've got to look into the other sources.
It's concerning if it's true.
Of course, yeah.
Because, like, for example, with other vaccinations we've had, many years of research has gone into them, as well as, human beings have lived for decades for us to be able to see any negatives from any side effects from these vaccinations. But with the COVID one, I understand the justification that they've used. When I say they, meaning the government or the pharmaceutical companies have used, how they developed it so quickly. But we still not any wiser about the long-term side effects, are we?
So in terms of long-term side effects, it's very difficult to find that out for across the board for vaccines, for medications in general. And what often we do is we use animal models, right? And use mice. And long-term for a mouse is different in the context of long-term for a human. You're definitely right in that we haven't fully characterized the long-term effects of vaccines, what they are. At the moment, it's difficult to say. I think it's still looking positive for vaccines, but in terms of a mouse's lifetime, we've got data for long-term effects on that, if that makes sense. So I think it was a difficult situation to be able to decide, do we delay further? Do we give these vaccines now? But I think perhaps lesser of two evils was thrown about earlier. It might just come down to that.
Okay, thank you. Thank you very much.
Thank you, Milin. Thank you, Zar. Thank you, everyone, for asking all the questions. If there is anything, we will answer your queries. Anybody else would like to ask? Or else we're going to wind up this session soon. Okay. Thank you very much. We can now stop the recording, as well as thank everybody. And it's good to be here, and we really thank you for coming here on a Saturday at 3 o'clock. And thank you very much, Milin, for being there. I know you're a busy doctor. Thank you, all of you. I don't think we would have done it without you, and hope you've gathered some information about the misinformation of COVID. And we will see you again next month.